provider. Not only will they not have their 20% forgiven or covered, but Medicare will charge them, they will be charged the whole amount because they haven't followed the Medicare Advantage rules. And then, of course, there are services that aren't covered by Medicare, like cosmetic surgery. So what happens when balance billing occurs? What should advocates be telling their beneficiaries to do, and how can advocates help them? First of all, tell the beneficiary not to pay the bill. And we recognize that this can be really difficult sometimes because beneficiaries are afraid that they're going to lose access to a provider if they don't pay, maybe a provider that they really care about and think is important to their health, or they need a procedure right away and they're very afraid it's going to be canceled if they don't pay. And unfortunately, they're right in some of these circumstances that they may actually lose the provider. But it's always harder to get your money back after the fact. And sometimes provider education, very often provider education and some advocacy can get the needed access and also get compliance with the law. And it's also important when you approach balance billing to recognize that many providers honestly really don't know what the law is. And also, sometimes they don't even know that their patients are quimbys or duals. So this isn't easy stuff, and you have to be doing a lot of education along the way. We advise that you start out with an educational mode and make sure that you get somebody that you're talking to who has enough authority and enough knowledge to understand the problem and to fix it. I provided a link here to a really